So when you look at this case study, this is what I and probably a lot of clinicians throughout the country see every day. So diabetic gangrene in the hospital, infection. So there's a lot of things you got to do. We're just not taking them down to the OR and cutting out this gangrene and doing this stuff. You have your vascular people come and see the patient. If there's a problem with the blood flow, I want it fixed before I take them to the OR, if I can. Obviously, if they have pus ringing out or they have gas in the tissue, then that's something I have to go and do first. And then we will get the vascular status restored. Infectious disease people got to come and start seeing them, right? We have to get MRIs, X-rays, all kinds of things. What if their A1C is out of whack? So we got to get endocrinology involved. We got to get them on vitamins. What if they don't have any vitamin D? I usually see multivitamin and protein drink too while they're in the hospital because they need good nutrition. Their body's under a lot of stress trying to heal this, and a lot of these people have low albumin levels. So we have to boost that up. So there's a lot of things that you have to do before you get them to the OR. And then once you get them to the OR, when you see all that gangrenous tissue, people are afraid to cut that out, right? Because you take out that gangrenous tissue, your bone's going to be there. Well, but how are you going to heal if you have this big hunk of gangrenous crap that is in the wound, right? All the bacteria and things of that nature. So you look in, when you start to look at the middle aspect, we cut all this out, we use Versajet, we clean all that out. If there's prominence of these bones of the malleoline, the navicular, we will take bone biopsies. We'll shave that down, get that bone bleeding, right? And we'll get that out to see if is there osteomyelitis and things of that nature. Now these patients are on Coumadin for it and is bleeding like a pig. But that's where then the Omni-stat can come in and you can have that confidence. You can clean these out, you can cut this out, you can get rid of the garbage tissue that's in there, the biofilm mass. And now you're going to put Omni-stat on there that will stop that bleeding in just a few minutes, not harm good tissue, not burn tissue. And chitosan has some capabilities, right, that's replete in the literature about stimulating fibroblast migration, mitigating the inflammation that is there, some antibacterial capability too. So now you have a hemostatic agent that can do 5 things. Better than collagen dressings, right? Before we add Omni-stat, what would I put on this? Thrombin and gel foam? Useless. What is that going to do for heavy bleeding like this, right? We would just be putting gel foam soaked in thrombin, which thrombin is only indicated for minor to moderate bleeding. This is pretty severe. So now you have confidence for that you can put this on. And if you look at the last picture, I mean, this patient has complete hemostasis. Now you can put all your dressings on. I irrigate off the excess, and I'll a little bit. I put a wound vac right over Omni-stat too. I haven't had a problem with that either, because these are things that we need to do for these patients because they're going to be in the hospital a while. They require multimodal therapy, multiple trips to the OR. They're very high-risk people. They can end up with amputation of this limb. So I think that people are afraid to debride all this gangrenous material, take these bone out because they're afraid of the bleeding. They're anticoagulated. But now you don't have to worry about that. Yes, you got to do your good medical practice. You have to do your good standard of care for this, but you have to be able to debride all this gunk away and get to good bleeding tissue before you can put skin graft, before you can use skin subs, right? So Omni-stat gives you that effect. Great hemostatic agent, chitosan itself, cell migration, mitigates inflammation, a little bit of antibacterial capability. Wow. And doesn't burn, doesn't harm good tissue. Second most ubiquitous ECM protein, polysaccharide in nature. Great thing. Body kind of recognizes that, can break down into glucosamine. Wow, what a great hemostatic agent, right?